Hello everyone. Today we are here with Dr. Adeel Khan, founder of Eterna Health. Hi, Dr. Khan. How are you?
Hey, good.
So, coming to my first question, you are widely recognized as a global leader in regenerative medicine and cell therapy innovation. Could you briefly share your journey and what inspired you to focus your career on this emerging field?
Yeah, I mean, a lot of people wonder why I went into this. It was honestly just because I started out as a sports medicine doctor where I was treating injuries and pain, and we're doing what's called plasma injections, PRP, which is where you take your blood, you concentrate the platelets, and you inject it back in. And I kind of work with the pioneer of that field. And so I learned about the foundations of regenerative medicine, which is basically the body can heal itself if you give it the right tools. So it really made me interested. It's like, oh, cool. Maybe we don't have to always do surgery or medications. Maybe we can get the body to heal on its own if we just give it the right tools. And so that's what kind of drove me down the path, was just wanting to help patients who aren't always being helped with the traditional options.
For those who may be less familiar, how would you define regenerative medicine and cell therapy in simple terms?
The simplest way to understand regenerative medicine is giving your body the right signals just for it to heal itself. It's imagine your body has a blueprint for healing and regeneration, and we're just unlocking what that blueprint is.
And why is regenerative medicine considered as a game changer in modern healthcare?
Yeah, because the system is plagued by chronic diseases, and chronic diseases meaning like neurodegeneration, like Alzheimer's, Parkinson's, heart disease, hypertension, cancer, autoimmune conditions, all these diseases that the system can manage, but we can't really treat or cure these conditions. So regenerative medicine has the potential to reverse these conditions, or even, or I don't like to use the word cure necessarily, but let's say reverse and put them in remission.
Eternal Health has become known for pioneering advanced stem cell therapy and longevity interventions. What is the core mission of Eterna and how does it differ from traditional medication?
Yeah, no, our mission when I started Eterna was always to make these regenerative medicine therapies accessible to the average person. So eventually, when you have a problem, instead of going straight to surgery or going straight to some sort of just medication, you can go to these regenerative solutions as at least to consider it as an option to treat your problem. So I want to make it more accessible to the average person. And as with any new technology, I think it's always the wealthy and the celebrities who do it first, which is a lot of the people we work with, but then over time, the cost comes down and becomes more affordable for the regular person.
Over the past decade, regenerative medicine has progressed rapidly. In your view, what are the most promising current breakthroughs that could realistically move from lab to clinic in the next 5 to 10 years?
Yeah, the most exciting one is definitely what's called epigenetic reprogramming, which is basically where you press the reset button. So imagine you can make an old cell young again. And so the problem with it right now is that when you do that, the cells have a risk of tumors or cancer because they're too embryonic and they're too proliferative. So imagine if we could do partial reprogramming, where it's like we can kind of unblur the genetic instructions a little bit and then make the cell younger and functionally better. We don't have that technology yet, but I think that's what's on the horizon in terms of breakthroughs.
So, like I read, you mentioned about autologous stem cells. It's like something related to after 40 years, the therapy doesn't work.
Yeah, exactly. So autologous just means from your own body, and your own stem cells age as your body does, right? They go through replication, they accumulate damage, they don't work as well. And so as your body gets older, so do your stem cells. And so after age 40, their gene expression profile changes, meaning that they start to have more pro-inflammatory gene expression. So the cells actually may cause more inflammation, and then after age 50 or 60, they can even potentially turn into tumors or cancer because they have senescent gene profile. And so you have to be careful using your own stem cells as you get older. When you're younger, they're probably safe, but the problem with a lot of these stem cells is that when you do them, a lot of them die and a lot of them get trapped in the lungs, and that's where the muse stem cells come in.
Coming to muse stem cell, Eterna promotes muse cell therapy as a next generation stem cell approach. What sets a muse cell apart from conventional stem cells, and how do they aid tissue regeneration and trend?
Yeah, so we were the first clinic in the world outside of Japan to start using the muse stem cells and talking about it publicly. So basically, the main difference is they're what's called pluripotent, which means they can turn into any cell in your body, heart, liver, brain, organs, and they're non-cancerous. So that's very unique because most pluripotent stem cells have the risk of tumors. So this does not have that risk. And then the other amazing thing about the muse cells is they're what's called stress enduring. So that's what SE stands for, meaning they can survive in harsh environments. So they don't die as easily. And then they also have what's called a homing mechanism, which is really cool. So when you do an IV, they can go from the lungs and the heart, and they can go all over your body. You don't get trapped in the lungs as easily as old stem cells.
A major goal in longevity science is to target the root cause of aging rather than managing symptoms. From your perspective, which hallmarks of aging are the most viable targets today and which are still too speculative?
I think the most reliable targets are mitochondrial dysfunction and that's one of the big hallmarks of aging too, because what happens as you get older, your body basically has to make food into energy. There's a metabolism, right? And as a byproduct of that metabolism, you get what's called free radicals, and that causes oxidative stress to your DNA, mitochondrial DNA as well. And over time, that's one of the root drivers as to why we get old. So we know now with the muse cells, with peptide therapy, I mean, that's why NMN, NAD, all these things became popular because they're all targeting the mitochondria, but they're not obviously as effective as some of these cellular therapies, but they're just much more potent. But I think that's one of the ones that we can realistically make a difference in. And then the other big one, I think, is what's called SASP, senescence associated secretory phenotype, which is basically chronic inflammation in senescent cells. So it's because of the muse cells, they act like little Pac-Men. So they eat damaged cells and then they turn into a new cell and that's functionally younger. So they can help to clear out senescent cells, and then they can change the microenvironment of the tissue, meaning they're reprogramming the cells from a pro-inflammatory state to an anti-inflammatory state. So they have these properties that we know that they're real, and we're seeing it with the data that we're starting to get where we do the aging test before and after the infusions of the muse cells. We can see a reversal of aging in those organ systems. So we know that we're actually doing something. And it's not just guessing, and you have the data. So I think some of the other hallmarks, such as, I think gut dysbiosis is still being worked on. Like we don't have a perfect solution for that. There's FMT, fecal microbial transplant, but it's not like we know exactly what bacteria to get because there's trillions of bacteria. And so it's still complicated. And I think that's going to take still some time to figure out. So that's, I think, one of the more challenging ones, but is a very important cause of aging too.
So, like, what are the most common misconceptions about the stem cell therapies, and how does Eterna set realistic goals and communicate progress?
Well, I think the two misconceptions is that safety, that they're not safe, and number two, that they're too expensive for the average person. I think those are the two things that most people get concerned about. And so the first is safety. There are concerns with certain type of stem cells that can cause tumors, like we said, certain stem cells that just might not be effective. So you do have to be careful what you're putting in your body. But muse stem cells, like we said, are unique, and they have clinical trials showing their safety, and they have hundreds of papers. And the other big thing is in the real world with using them for, hundreds of patients, we don't see any major adverse effects. Like it's very safe. So that's the other reason why, as a clinician, then you can also see that, hey, this isn't causing harm to my patient, and they can have a lot of upside. So I think safety, and then in terms of pricing, the pricing has come down, and it will continue to come down with time because as there's economies of scale, as there's more innovation in manufacturing, there's going to be more demand for it as well. Then the price will come down. So it is expensive, but it's not necessarily out of the reach of the average person, especially people who, over time, you spend a lot of time on other expenses, and you can kind of reallocate your resources to kind of prioritize your health.
Like, what kind of like medicine or therapy is involved for the treatment?
Well, it's very simple. That's the good thing about the muse stem cells. It could just be an IV for longevity and anti-aging, and the muse cells find their way to the different problems. So you don't have to inject them directly into the heart or brain, for example. You can just do an IV, and they have a reprogramming effect on your body, and you can see the aging being significantly reduced with the IV of the muse stem cells.
So, like, other patients who you're treating are also provided with, medicines.
They're provided with peptides sometimes as an adjunctive therapy to help the body prepare for it, or optimizing their hormones. So you do want to, let's say, I always say, prepare the soil before you plant the new seeds. So we do have a functional geneticist on our team, for example. We work with some doctors who will help us to collaborate on the more complex cases to make sure that the body is optimized as much as possible before doing the stem cells. But typically we're not using prescription medications. We're just using more supplements and peptides and stuff like that.
What are the main scientific, regulatory, and ethical hurdles in bringing regenerative therapies from lab to clinic, and how is your team addressing them?
That's probably one of the reasons I moved to Dubai is because it's a more permissive environment for these type of regenerative therapies. In Canada, you can't do a lot of them. US, they just passed a law, now you can. So we have a clinic opening in Florida. But the regulatory agencies, a lot of them have an antiquated system for allowing these cell and gene therapies to get approval. So I always say, look to Japan, which has a very progressive system, which is basically, if you've done phase 1 trials for regenerative medicine and you've shown safety, then they allow you to go to market and then do what's called post-market surveillance and just monitor for efficacy and then see ongoing without having to necessarily do phase 2, phase 3, and everything else, because that usually costs like $100 million to go through all those trials. And unless you're a big pharmaceutical company, you just don't have them. It's not possible to do that. So for something that has as much promise as these technologies, there should be an expedited pathway, which is what Japan does. And I think that's what the model should be in other countries as well.
So, like, I believe you have treated celebrities like Chris Hemsworth, Zac Efron, and Kim.
Yes.
So, could you like talk more about that? What kind of treatment?
Yeah, a lot of people wonder, why are the celebrities coming to us, and they're curious. In those cases, most of them actually have injuries or pain. Like, so Zach and Chris had back pain, Kim had shoulder and back pain. So we actually fix those problems. And chronic pain and it affects everyone. It doesn't just affect regular people; it affects celebrities too, right?
Right.
And it can be something that's difficult to live with, and something that you want to not have to just take a pill for. You want a solution. So that's what we were able to provide them. And then of course, a lot of them are interested in longevity and cosmetics and anti-aging as well.
Also, looking ahead, what do you envision as the most transformative interventions in regenerative medicine that could significantly extend the human lifespan, and how you're preparing Eterna Health?
Well, there was a study just published in China Academy of Sciences, where they had these monkeys and they infused them with these senescent resistant cells. And they're basically engineered to be resistant to senescence so they survive better, similar to the muse cells. And they infused them every 2 weeks for 44 weeks, so almost a year. And they found that the monkeys de-age significantly in multiple organ systems. So I'm pretty confident. We don't have the data on humans yet, but I think the muse cells, if we don't know if we were able to dose them that frequently, like I'll say every couple of weeks or every month, maybe eventually when the costs come down, I think you could actually see significant reversal of aging just with muse cells, because they're pluripotent stem cells, right? And we know, like, for example, the planarian. Planarian is a worm that can, if you cut it, it can regrow it can regrow, and it doesn't, and it can regenerate. And so the reason planaria, they call them like the immortal worm, so to speak. And the reason planarias can do that is because of pluripotent stem cells. So if you have an unlimited supply of pluripotent stem cells, theoretically, you can keep healing and regenerating, repairing your body. So that's, I think, one of the possibilities in the future.
Coming to the last question, what kind of market footprint you are expecting in Middle East, especially in UAE, and how you are like preparing to expand your operations here?
We're trying to be the leaders in regenerative medicine for the region, because we really want to set the standard and educate people that this is the right way to do it. And we have the experience and the, obviously, research and the clientele to kind of tell people about our brand. And then I think a big part of it is, for us, is over time, as regulation in other countries change, like Saudi, Qatar, all these countries will eventually allow for stem cells as well. It's already starting to happen now. So then we'll expand as these countries open up.
Right. I think that is all. Thank you so much for speaking.
Yes, sir. Thank you.
Thank you.
Thanks for having me.